Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. Since 2010, Partnership for Healthy Lincoln has hosted Streets Alive, a healthy outdoor festival that invites people to literally play in the streets. To find out more, I'm joined today by Ashley Deisler and Tami Frank from Partnership for Healthy Lincoln. Thank you both for joining me today.
Thanks for having us.
Let's start with Tami. Now, for those who don't know, tell me what Streets Alive is.
So Streets Alive is an annual outdoor movement festival where we close down about 2 miles of city streets and open it up to fun, interactive exhibits and entertainment to bring health resources to the community and encourage people to get out and active in their neighborhoods.
Good. Now, how did it start and why?
Well, the concept of Streets Alive is kind of that open streets concept. Actually started in Bogota, Colombia in 1976. And it's really grown there over the last 40 years. Now they have an event that's a weekly event on Sundays from like 7 a.m. to 2 p.m. They close down major major streets and just really encourage people to get out and active. In the it's been to many other countries, but here in the United States, for the most part, it's kind of an annual event. Some people have been able to do it more often than that. In Lincoln, this is our 5th year of hosting the event, and it really started as part of a grant that we received from Community Health Endowment to host an annual event, and we wanted something that really spoke to the mission of Partnership for Healthy Lincoln, which is part of it is to increase physical fitness. So when we were looking for models out there, Streets Alive really seemed to fit with our mission.
So you say Streets Alive has been going on for 5 years. How has it evolved over those years?
It has changed every year as more people have gotten interested in the event and have heard about the event. It's grown. We had our largest attendance ever last year with over 5,000 people. One thing that's unique about Streets Alive is that we have taken the event to different neighborhoods. So every other year we've moved it to a different neighborhood. And really that comes from a partnership with Lincoln Public Schools. We work with them to collect and analyze their fitness and obesity data, and what we've found through that data is that really fitness and academics are related, and so we've tried to partner with the schools and highlight some of the elementary schools around town and focus health resources in those communities to help improve the health of those neighborhoods.
And how has the response been to Streets Alive?
Very positive. Everybody loves Streets Alive. We've done intercept surveys and exhibitor surveys after the fact, and everyone rates it as positive or very positive experience. What's not to love about a fun, free family activity that you can do on a Sunday afternoon? So.
Very good. Now, Ashley, tell us what's in store for this year's Streets Alive.
We have all kinds of fun things planned. We are bringing it to a new location this year, the Clinton, Hartley, and East Campus neighborhoods. So all kinds of fun things. We have healthy exhibitors along about 120 along the 2-mile route, and we'll also have fun things like fitness boot camps, yoga classes. We have entertainment such as Tuna Fish Jones, kid-friendly string beans, inflatable obstacle courses, and all kinds of fun things. So.
Great. Now, what's the best way to get to the festival?
We do have public parking available. Also, we do encourage people to bike in or walk in. The Mopac Trail goes right through the heart of Peter Pan Park. So we do encourage people to bike in if they can.
Now, who are some of your partners that are going to be participating in the event?
Well, one of our big sponsors is Community Health Endowment, so a big thank you to them. Our Streets Alive Planning Committee is made up of several community partners, which includes we have Parks and Rec, NeighborWorks, City Impact, and the hospitals as well have been great sponsors.
Okay, so very good. Now, if there is an organization who's interested in being a vendor, or there's just somebody in the general public who wants to know more, how do they learn more?
Yeah, the best way to find out more details, and if you want to get set up as an exhibitor or a volunteer entertainer, just go to our website. It's healthylincoln.org/initiatives/streetsalive, and you can sign up right there.
All right, great. It sounds like a wonderful event for individuals and families. Thank you both for being here.
Thank you.
When we return, we're going to hear about a great program that's a partnership between the Lincoln Police Department and the Mental Health Association of Nebraska.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for Healthy Lincoln wants to help you and your family live longer, healthier lives. It's easier than you think. Take the dog for a walk, play more and text a little less. Swap out a soda for water once a day. Keep fruits and veggies handy for snacking. These simple changes can add 5 years to your child's life and make your whole family healthier. For more information, visit healthylincoln.org.
Welcome back to Shape of the City. I'm Clover Frederick, your host. Since 2011, the R.E.A.L program has provided mental health services and resources to citizens of Lincoln and Lancaster County. So what does this program really do? To learn more, I'll talk with Chad Magdanz from the Mental Health Association of Nebraska and Sergeant John Walsh and Officer Melissa Ripley from the Lincoln Police Department. Thank you all for joining me today.
Thanks for having us.
Yeah. Let's start with Chad. Now tell me, R.E.A.L is an acronym, correct?
It is.
Why don't you tell me what that stands for and then tell me a little bit about the program.
It actually came from a participant when we were changing the name about a year ago, and it stands for Respond, Empower, Advocate, and Listen.
Great.
R.E.A.L.
Great. So tell me what the program does.
Well, what we do is we get referrals from law enforcement officers and other organizations in Lincoln for folks who may not be doing so hot, having some mental health problems, but aren't necessarily breaking the law, doing anything illegal, but need some extra care. What happens is we get a referral from the law enforcement officer who has already met the person and been on the call, and they give us a referral, and we go out there and meet them, see what's going on.
Great. How important is this program to our community?
It is a really important program for the community. It's a program that is proactive and it is a quality of life measure that helps people out. It's also a financially responsible way to treat people, get them help they need before the crisis happens.
Very good. Now, what organizations or government agencies are involved in the R.E.A.L program?
It started out with the Mental Health Association of Nebraska, Region 5 systems. And then it was with the police department originally. 6 months ago, we started also working with Nebraska Corrections, with folks coming out of the penitentiary, York, Tecumseh, places like that. Same ideas, getting people the resources that they might not necessarily know about, getting them plugged in with things, people to talk about, people who've possibly experienced the same things they have. Okay,
very good. Now, what has the success been for this program?
More than expected by a long shot. Since it started in 2011, we've had almost 1,200 referrals. We've had almost 300 officers use the program. It's a voluntary program on their side too. They're not required to use it. They recognize it as a tool. We get in touch with about 60% of the people we have been given referrals to, and out of those 60%, about 85% accept services. So that's a number of about 600 people who are getting services and are plugged in now that weren't.
Great, very good. Do you have any specific stories you can share?
One that I really like, and one that was very challenging to say the least, was we got a referral for a gentleman who had problems with a car wreck, an undiagnosed TBI, but also the drink problem. Had drank a lot for a long time. He was in very poor condition, infested with bed bugs in his apartment, not really knowing where to go, family not knowing where to go. When we were referred to him, we helped him with all of those things. We do things in a level, you know. Of course, we need to get rid of the bed bugs before anything can happen. We did that. We helped him get into doctor appointments, physicals, was there when he needed to talk, when he felt like drinking again, helped him with support groups, helped him and assisted him to get into Valley Hope and O'Neill. And he's working today, and he is doing what he needs to do in a clean apartment and doing and utilizing the services of his choice. So.
Very good.
Yeah.
Thank you.
And that happens a lot, things like that.
Yeah, great. Now, Officer Ripley, why don't you explain what Lincoln Police Department's role is with this program?
Our role is basically to make the referrals, and what that looks like is if we are to go out on a call for service where someone may not meet the criteria to be placed in emergency protective custody, maybe they're on the verge of a crisis or aren't necessarily an immediate danger to themselves, but still need some kind of services or some advocacy or would benefit from receiving assistance in getting resources throughout the community. We make a referral, which is just a simple email to the R.E.A.L program, and we know within 24 hours that person will be contacted by one of the peers that work with the R.E.A.L program. And the nice thing about that is that we may not have time as a police officer to walk them through the system and be able to show them all the resources that Lincoln has to offer them, but we know that someone will be in contact with them and they will hopefully get the help that they need in the end. It's one of the best resources that we have as police officers, really. So.
Thank you. Now, Sergeant Walsh, I know that you've seen some successes with this program.
Yes.
Tell me more.
A couple years ago, we did a study and we compared some of those folks who had accepted services from the R.E.A.L program and some who hadn't. And we found that over a course of time, that being about 6 months, they were less likely to be seen and evaluated on a mental health call for service. And also they were 16 to 22% less likely to be arrested. So it's affecting kind of all facets of their lives at this point. It's real important for us when we have kind of constant run-ins with people to maybe determine what's going on in their life and if this is something that we can help them out with and make that referral to. It's not only beneficial to them, but it's beneficial to their neighbors and then to the police officers as well.
Okay. Now, what would you tell other police forces about this program as far as how they can help their community?
Well, I would mirror what Officer Ripley said. This is invaluable to us. There's a lot of really hard problems and cases that I've personally sent them that they've worked with. I know of others that they've talked with, and these are folks that normally we probably wouldn't have had much to do with other than here's a sheet of places you can call, it's up to you to do that. Sometimes we do direct handoffs. When the situation's bad enough, they'll come out and help. It's right, it's what we got into this job to do, is help other people. A lot of times I can't do that and Melissa can't do that, but when we put them in Chad and his staff's hands, we know they're going to be safe, we know there's going to be a good outcome. But again, it's up to that person, and we're giving them every shot to succeed.
That's great.
Yep.
Now, Chad, what does the future of the R.E.A.L program look like?
Well, we've worked with the Community Health Endowment since the beginning of this. They've helped us with data to prove that what we're doing works, as John was talking about. And we're just going to be talking with the county in the weeks to come and talk about financing and making it a permanent program. And it is proven itself successfully, and it's a good way to treat people.
Very good. Now, if somebody in the general public would like to learn more, how can they learn more about the program?
We have a very simple website, www.mha-ne.org, or our office phone number you can call. I'm going to look at that quick. It's 402-441-4371. Call, someone will be there, or leave a message. So.
Great. Well, thank you for all the work you're doing here for our community. We appreciate it. Thanks for being here.
Thank you.
Thanks, Clover.
Mm-hmm. Stay tuned for tips on how you can fill up without filling out.
I'm a pedestrian.
I'm a driver.
I'm a cyclist.
And I share the road.
Hi, this is Michelle Welch with Lincoln Public Schools, a registered dietitian, talking to you about you and your family's health. So when we talk about full, we're also really talking about protein if we want to stay full for longer. The average person needs about 20 to 30 grams of protein each meal to be able to stay satisfied between the meal. Otherwise, you know those meals where you have them and in 2 hours you're starving to death. So when we look at opportunities, one place that we can make a huge difference with little calories but a lot of bang for your protein buck Really, milk products can be great. If you look at a glass of milk, it has about 8 grams of protein. When we get clear down here, we're looking at about 5 grams of protein, but 200 calories versus about 90 calories for skim milk. So when we really look at the difference, all of these, this milk is 8 grams of protein, the yogurt, the cheese stick, and the egg are about 6 to 7 grams of protein, and these are actually only about 6 grams of protein and 5 grams of protein. So when we really look at the difference, if you're trying to run out the door with a granola bar in the morning, it's not going to get you there unless you're getting a very specific high protein granola bar. Adding a glass of milk and having a piece of fruit will make it feel like it sticks with you longer, will make you full, and will keep you happy for a lot longer into your morning. We all have those moments where we're craving something salty. And so I wanted to show you an example of 3 different volumes that you can have when you're really talking about having about the same amount of calories with really pretty much the same product. If you choose wisely, it can make a big difference in what happens with your waistline. We all also know that sometimes festive beverages get paired with things such as salty snacks, and so if you know that you don't have very good limits with that, be real careful as you're choosing. This is a great example of like a 100-calorie pack popcorn where you have it already contained into a serving size, so you don't have a tendency to kind of end up eating more than you plan to. If you use a measuring cup and you like a real crunch and are having a real crunch fest, something like the corn nuts can work out really well for you if you put them into a small container like I have here and limit yourself to that amount. Here's the sad one for me. Our family loves chips, and that's probably one of our biggest troublemakers for us. But 6 chips are the same as either one of these. And who eats 6 chips at once? So be smart when you're thinking salty to really right-size your portion and come up with things that will help you to feel satisfied with the amount of foods that you're eating. How hungry are you, or really, how thirsty are you? What we really find is, for people, both kids and adults, we have this tendency to think we're hungry, but a lot of times we're thirsty. We really need to be drinking about 4 cups of water a day, or the equivalent of 2 water bottles. If we do that, in addition to having fruits, vegetables, and lots of other foods that have water in them, have milk at our meals, we can have enough fluids in our body so we'll feel less hungry and be more hydrated. So when we are talking about feeling full, but also really having a craving for something sweet, we have some really great options to be aware of. Really, fruit is a great way to be able to not only feel full, but also to feel like you're getting a lot for your calorie. So if you look at what I have laid out in front of me, all of these are equal to each other in the amount of calories that they give you, but they definitely aren't equal in the amount of nutrients that they give you or in how full they make you feel. All of these fruits are going to do so much more for us, and we know we can eat a lot of that boxed candy if we're at the movies. So kind of keep in mind what a big difference fruit can do to be able to give you that little bit of sweet without filling you out. So when we're talking about staying full and feeling good throughout the whole day, keep in mind water matters, fruits and vegetables matter, fiber matters, and protein matters. If you pay attention to those factors, you're going to find that you feel more full and that you're a lot happier across the day with the food choices that you make. This is Michelle Welch, registered dietitian and wellness facilitator for Lincoln Public Schools.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thank you for watching. Until next time, stay active, eat healthy, and stay informed.